what to do about those arms after 50 that waddle and women don't like. Dr. Mesa, what do you offer women who say, I refuse a brachioplasty, the scar from the elbow to the armpit?
The thing that I found that works the best is a liposuction procedure where you introduce heat and somewhat of a thermal injury to the subcutaneous fat, so it creates a contraction and then kind of stimulates that tightening of the arm, similar to, but definitely not the same as an arm lift procedure.
I think the brachioplasty with a scar is still going to give the best overall result for most women, depending on how much excess skin there is. Because you do get some additional tightening when you add energy to a liposuction procedure. The question is, do you really get enough to take care of all that extra skin?
So let's take the gastric bypass or the massive weight loss patients off the table, because most of those patients are not going to do well without a big scar. So now you have your typical woman in their 50s, they have a little extra fat. The question is, how much extra fat do they have? So I'll throw it back to you guys. So what energy technology do you like to use for this? Any advantages, pros and cons of one over the other? And second question for everybody, what about mini brachioplasty, where the scar is just in the armpit?
So I still do straight up liposuction if the skin tone is good enough. I think the addition of energy adds expense, and I'm not convinced that the extra skin tightening you get is really clinically meaningful.
What patient do you say, I am so sorry, exercise won't help you, pre-treating your skin, laser won't help you, you have to have surgery to get rid of your waddle?
You know, this is where it's a judgment call. And I think we all have slightly different judgment on this. For me, it's I look at a patient, you know, after a certain number of years, you look at them and you go, yeah, you're too far gone. You need a bigger surgery.
Again, I think it's really important with any cosmetic procedure that you examine the patient, identify what's bothering them, what their anatomy is, and manage their expectations.
So really the bottom line, I think, is arms like bodies. There's a continuum of care. You know, there's different things we can offer, and we have to understand our patient, you know, really well and their expectations so we can meet their goals.